Okay, good evening and welcome, and thank you for attending our Head of Cancer lecture series this evening, sponsored by the Allegheny Health Network Cancer Institute. My name is Margie Leslie, and I'm the Director of Nursing at the Cancer Institute. Here are a few housekeeping items that we want to review before we start. During the presentation, all participants can type questions into the chat as well as the question and answer portion of the Zoom. We will be addressing those questions at the end of the lectures if time allows. Participants are not able to speak during the conference, but again, we encourage feedback via the chat option. Our topic tonight is cracking the cancer code, navigating the web and social media for valid and trusted information. We're excited to have with us this evening Dr. Ariel Lopez Chavez and Rihanna King joining us for these presentations. I'd like to take a moment to introduce each of them to you and give you a glimpse into their outstanding work. Rihanna King is a senior social media marketing analyst with Highmark Healthcare, where she develops social media content for the Allegheny Health Network Cancer Institute on our AHN brand channels. In this role, she focuses on highlighting the Cancer Institute's accessibility and reputation while promoting opportunities to expand its reach. With a deep familiarity with social media platforms and how information is shared online, Rihanna is passionate about helping people access reliable resources and information about cancer care options at AHN. In addition, Dr. Lopez Chavez will also be speaking. He is the Director of Precision Medicine and Developmental Therapeutics at the Allegheny Health Network Cancer Institute. A specialist in thoracic malignancies, he focuses on developing customized cancer treatment plans for patients. Dr. Lopez Chavez completed his residency at the University of Pittsburgh Medical Center and his fellowship in medical oncology at the National Cancer Institute in Bethesda, Maryland. He previously led clinical and research programs at Oregon Health and Science University Knights Cancer Institute, and the University of Miami Sylvester Comprehensive Cancer Center. Board certified in medical oncology, Dr. Lopez Chavez is dedicated to improving outcomes, enhancing patient experience through innovative cancer treatments and technologies in our region. Welcome, Rihanna and Dr. Lopez Chavez. And first, we'll be turning it over to Rihanna for her portion of the presentation.
Thanks so much, Margie, and honored to be here with you all this evening. As our world is becoming increasingly digitized, it can be hard to find trusted and reliable information, especially when it comes to cancer care. So tonight we're going to dive into a little bit about understanding the digital landscape in terms of what platforms are out there or where folks are going to find their information, how social media and online algorithms can prioritize misinformation, and what are those impacts on patients, right, positively or negatively, and how do you protect your privacy in, again, an increasingly online world, especially when navigating a cancer journey. And then how do you crack the code in terms of, identifying these misrepresented pieces of information, or what are the red flags that you should be looking for when you're disseminating this information and taking it at face value? And then lastly, again, identifying those factors that, establish the resources as reliable and as trusted sources. So as I was saying, these platforms can be a great way for folks to connect, but there are also some disadvantages in terms of the amount of digital noise out there and deciphering, what is accurate, what is inaccurate, and even potentially finding harmful information when it comes to searching for information about cancer care and cancer treatment options. So to dive in a little bit about how the platforms work sort of behind the scenes, specifically talking about social media, the algorithms can actually prioritize content based on engagement, but not necessarily on accuracy. So to break that down a little bit further, say that you are a cancer patient and you identify yourself online, whether that is joining a Moms with Breast Cancer Facebook group, or liking the Allegheny Health Network cancer page, for example, or you check yourself in to the Cancer Institute at Forbes for your radiation appointment. these platforms can synthesize that data and associate that with your individual account. And in doing so, it's kind of marking you as being interested in being served cancer related content. And so, based on your activity, you can get funneled this content because Facebook knows that you are kind of interested in this information. And even though the content may not be reputable, accurate, it could have a lot of comments, but the comments could be spreading misinformation. The platform is still going to feed it to you based off of your interests. So that's something to just be mindful of, because misinformation can be easily pushed, to susceptible users. Still, as I previously mentioned, there are, many positive impacts of being able to use social media and online resources when it comes to your cancer journey. Community support is a huge one, again, in terms of joining support groups or finding other, folks that are going through the same experience, maybe not even in your own geographic region. The ability to connect, at such an instantaneous capacity has been a really great resource for folks to find that sense of community, especially from others who understand your experience firsthand. And also, again, that emotional validation of, someone else is understanding what I'm going through, and I'm making those connections and feeling like I'm not alone in my journey. In terms of discovering resources, patients or their caregivers can find information about, latest treatment options, free resources in the community, whether that's, WIG programs or perhaps establishing free transportation to and from cancer appointments. And again, being able to just discover those resources that might not otherwise be known to be available to you. In terms of research new innovations or changing screening guidelines. I mean, again, there's so much information out there that being able to be more empowered in your own care in terms of being able to have this information at your fingertips can certainly be advantageous, especially for folks that live perhaps in more rural areas or that are attached to, smaller or more rural health systems. Being able to get connected to experts, in your particular cancer that, might be further away, but you have the ability to kind of connect and to chase that best care possible. These are all, again, positive impacts of being able to have that platform online for connection and for community. Now, there also are some risks associated for using social media or the internet to kind of find, resources or information regarding cancer care. As previously discussed, these platforms can amplify sometimes an excess of inaccurate or misinformation. From the promotion of maybe unproven treatments to inaccurate risk factors for particular cancers. And then in this instance, the burden is placed on that individual to kind of decipher what is true and what is fabricated. That can be especially difficult when the information is coming from sources that seem reputable. Especially with AI growing in our world, it can be hard to decipher where the information is actually coming from or if it's coming from a reputable source. And information overload can have negative impacts on mental health, and inducing feelings of anxiety or depression, whether that is not feeling like you're on the right treatment path because you're seeing other things and why is this working for someone else and not for me, when you don't really have all of the context, of why that could be the case, or not understanding, why this certain treatment might not be applicable for you based on your specific cancer and your specific, health situation or health journey. Privacy is a big one, in this day and age, and patients should especially consider the information that they're sharing online about themselves, specifically regarding their diagnosis or their treatment plan. Luckily, there are, privacy settings on these social sites, and even some things you can do on web browsers, such as, clearing your cookies, perhaps even browsing in private browsers. And that is just an attempt to curb, some of these spam accounts that you can come across, or being, again, fed some of that information based on your activity, and in case you just don't want to open the door to having to decipher, what is accurate and what might not be. And also further, patients should communicate their preferences about their own privacy, about their diagnosis or their treatment with their loved ones. Because patients are ultimately in control of their journeys. And if folks are sharing on your behalf that's information that you might not want out there, that also could be opening the doors to other opinions, or again, just more of that kind of digital noise that can make it kind of hard to navigate through the cancer journey. So how do we kind of spot this misinformation, and what are the common areas of information when it comes to cancer care that are misrepresented? A big one would be information around screening guidelines. So minimum ages, recommended frequency. For example, the U.S. Preventative Services Task Force recently lowered the age recommended for colorectal cancer screenings from 50 to 45. And a few other ones, including mammograms, have changed recently too, based on, science advancing and the data that we discover. So sometimes that information is not always up to date. And then again, that can have patients questioning, well, am I due for this? Should I be partaking in this? Should I not? Risk factors is also another big one, both in terms of what can lead to even getting a diagnosis of cancer. There can be a lot of sensationalized headlines out there, right, around deodorant causing cancer, or smartphones, or getting a biopsy for cancer can cause cancer. Granted, we know from research these things to not be true, but again, when there's so much digital noise, it's hard to decipher, is this accurate or is this not? And hereditary factors as well too, just because you don't have perhaps any history of cancer in your family, that does not necessarily mean that you, given your genetic makeup, are in the clear from, potentially going down the path of getting a diagnosis. So just, seeing things out here can either make you feel like you are destined to be susceptible or not susceptible. And again, these are just things that the individual user has to decipher as you're encountering some of these resources. And then lastly, in terms of treatments, again, the latest and greatest innovations in terms of surgeries or clinical trials, there's a lot of factors at play as to why those might not be the best fit, why they might not be offered in a geographical area. Some may say that there are other treatments that are not medical. For example, like more holistic care, can herbal supplements, treat cancer? Again, there's a lot of information out there to decipher when it comes to the sort of tenets of care. Some red flags in particular to look for when it comes to web pages or blogs or social media, chat boards or groups, is again those exaggerated or those sensational headlines. Is this source claiming to have discovered a miracle cure for a particular cancer? In terms of bias or commercial interests, does the source seem to be promoting its own interests? Does the article have a lot of paid advertisements? And also, who sponsors or who funds the webpage? Is it governmentally funded or sponsored? Is it a nonprofit voice, or is it a commercial interest? The tone of the piece is also important as well. Is it more informational or conversational rather than sensational? Also, is the article kind of placing the blame on the patient in terms of lifestyle choices that have led to a diagnosis, even though there are other factors at play that aren't correlated? And where does the information come from? Is there clear sourcing? Is this a trusted source? Is the information up to date? Was it relevant at some point, but now there has been new information that has come out that has now made this information outdated? And is the information coming from, a doctor? And if it is a doctor, is it a licensed physician in that correct specialty, that the person is discussing? Now, when it comes to finding those trusted sources, just a reminder that your primary source is your care team, and no advice online. While it can be nice to form those more personal connections and again find other folks that are maybe experiencing similar things, none of it should take the place of the advice of your care team, as your doctors are the most familiar with your history, especially given modern day genome sequencing and cellular therapy. Your physicians can get such a crystal clear look at the specificities of your cancer, that they, ultimately have your best interests at heart. And in performing, a critical evaluation of information that you are coming across online, again, these are just a few guiding questions for you to evaluate those sources. A big one for web pages in particular, is this coming from a .gov or a .org website versus a .com? That can sometimes be an indication of, whether a source is reliable or not. Is the information research based? Is it citing up to date and credible sources? And again, comparing what you're reading to your doctor's advice, does this align? If not, it might be something worth flagging to your care team to discuss further. And ultimately, again, remembering that someone else's personal experience does not directly translate to your own. And sharing that experience can be a great way to develop that sense of connection and support. But ultimately, understanding that there are limitations to testimonials, given there are many factors at play when it comes to the individual cancer journey. So these are just a few reputable organizations: the American Cancer Society, National Cancer Institute, the American Society of Clinical Oncology, and the National Comprehensive Cancer Network are just a few that, if you are searching for information about, am I on the right treatment plan, or what is the latest clinical trial for lung cancer, in addition to consulting with your care team, these are just some trusted resources that you can feel a little bit better about if this is what you're coming across, as taking it as trusted and up-to-date information. And as well, there are, resources within Allegheny Health Network. As mentioned previously, I specifically contribute to the Allegheny Health Network social media pages on behalf of the Cancer Institute. The Cancer Institute also has their own Instagram page. AHN.org has a breadth of information from our treatments offered, our specialties, getting connected to physicians. Our Highmark Health digital magazine often has articles that interview our physicians, oftentimes our oncologists, about latest innovations or procedures or risk factors for certain cancers. Obviously, if you are here, you are aware of our Head of Cancer lecture series, can also be a great resource for trusted information. And lastly, again, relying on that community support, not to say that, it cannot be valuable. At AHN, we've recently launched a community cancer patient ambassador program where patients can be paired with other AHN patients that are either still undergoing treatment or they have completed their treatment. And they are just sharing that peer-to-peer personal advice to kind of help folks along, with all of the questions that come along with their cancer journeys. So thank you. If there are any questions, we will get to those at the end, hopefully. But I want to give enough time and pass it over to Dr. Lopez Chavez.
Okay, thank you. Well, any conversation in regards to information related to cancer available in the web now, we have to discuss AI chatbots, right? They're the big elephant in the room. That's why I have the big elephant here, right? Because now, since 2022, when ChatGPT came out, then it has become very, very relevant for patients to know how to appropriately use these AI chatbots for cancer information. So we're going to build on these digital literacy topics that Rihanna mentioned, then to go over the topic of the use of AI chatbots. And the reason why they're a big elephant in the room is because they're associated with a lot of potential benefits, such as faster access to information, personalized information, and a potential to simplify complex topics. So in some areas, then they could be more useful than simply going to Google and search for cancer information in the web, right? But in other areas, then they can be risky as well. They have also the potential for inaccurate information. They can have biases, privacy concerns, and then in general, an over reliance in technology. So here in this presentation, I mainly wanted to focus on some practical aspects on how to use these AI chatbots to search for cancer information, and just to make you aware of some of the technical issues related to their use and some privacy concerns, and in general how to make the best use of this technology, mainly focusing on a practical aspect. But first, let's just go over then the basics of an AI chatbot. And this is actually a definition that an AI chatbot gave me about how to define an AI chatbot, which is imagining a computer program that can understand and respond to your questions like a human. And I think this is a very accurate type of description of AI chatbots, right? So just from the practical standpoint, they're simply computer programs. From a more technical standpoint, then they're driven or they rely on this technology called large language models, and we have many different large language models. But in essence, then they're just there to understand human language and respond to our questions. Now, in regards to AI chatbot examples, then we have different ones, but here I'm just mentioning some of the bigger ones, the most popular ones, starting with ChatGPT. ChatGPT was the first one that came out to the public back in November of 2022. And then rapidly Gemini came to the picture. That's the one that it's made by Google, and Copilot also it's a Microsoft AI. So in general, when I'm referring to the AIs here, then I'm pretty much just referring to this big tree. You can find more specialized AIs, and there's probably gonna be specialized AIs that can focus on medical information as well. But depending on the maker of these AI chatbots, then one would need to be careful in regards to what data they're being fed to respond to your questions, because then depending on the source, then we can have more concerns about biases. In general, ChatGPT and Gemini, the sponsors of them or the makers of these AI chatbots, then tend to be big companies. They tend to feed them with enormous amounts of data. So in general, right now, I think I consider ChatGPT and in particular Gemini to be more reliable in general for medical information. In particular, I would say that Gemini probably more reliable. If I would have to say that one is more reliable, I would say Gemini. In particular, because when you search for information in Google, then Gemini, then it's able then to give you an answer, and not only give you an answer based on its data, but it can also point to the sources of information directly in Google. So it tends to be easier then to verify the information that the AI is giving you, right? Rather than with ChatGPT, it's a little bit more difficult to know where that information is coming from. So in general, then in these examples, then I would just my preference in general would be Gemini. Just once again because the sources of the information are more readily available. Okay, now another practical aspect for the use of these AI chatbots is the mastering of the prompt. And the prompt is essentially just the question, right? So every question that you ask an AI chatbot then is essentially a prompt. Whatever you're writing there to communicate with the AI chatbot, that's what it is. And the way then to see these prompts is that they're going to be more powerful when you give them more specific information, because AI chatbots, even though they're very powerful, they can only answer the questions that you're asking them, right? So the more specific that your prompt is or that your question is, then the better the response. And here there's an example that to think of it like a librarian, the more details you give about the book that you're looking for, the more helpful that the librarian can be. And it's the same thing for the AI chatbots. So just to give an example about prompts. So let's say that then you're asking Gemini a question and in regards to your treatment, then if you tell Gemini, tell me about cancer treatment, then that would be way too vague, right? So it will then just give you an answer that it's very general and it may not help you at all. Now, an example of a good prompt would be, what are the current treatment options for stage 2 breast cancer that has tested positive for the HER2 protein, and what are the potential side effects of each according to the NCCN guidelines? So as you can tell here, then there's a lot of information. A lot of information is extremely technical. You may not be familiar with all of these terms, but probably this kind of prompt will give you, way better information than anything shorter than that, right? So then that's important to know, and it is in particular important to know the key ingredients of that prompt. So it's essentially keywords and phrases are the key here, right? So for example, mentioning the cancer type is very important, right? So if you have a question about lung cancer, then you need to specify that it's for lung cancer, or melanoma if it's melanoma, or breast cancer if it's breast cancer. It's just very important to spell it out. If you have information about the stage of the cancer that for which you're looking information, then it's also important to mention the stage. And then this is something that your physician will know, or that it will be mentioned in your notes, but it's something, once again, that you're going to have to get directed from your healthcare team. The treatment, then also to be very specific, if it's chemotherapy, if it's immunotherapy, or spelling out the name of the particular treatment that you're interested in is also very important. Symptoms, also be very specific in regards to symptoms. And finally, the genetics of the cancer is also very important. If you have questions about your cancer, specifying if the cancer is positive for HER2, or specifying a particular genetic characteristics of the cancer also would be very important in regards to the response to your question. So once again, you will see that these tend to be, this can get very technical, and you will probably, to get the most accurate information, you will probably have to ask your healthcare team to give you the answers to all those questions, and by then you may very well ask the question that you have in mind to your healthcare team. Now, the other important thing is to add in context and constraints to the questions, right? In the prompt that I mentioned, that is a good prompt, then I mentioned a particular organization, right? So if you specify that you only want information coming from a trustable source, then the AI chatbot will go directly to that source and bring the information to you. So in a sense, it will help you browse through that information, right? So for example, if you ask your question and you want the question to be answered according to the American Cancer Society, then the AI chatbot will go to the American Cancer Society website and will browse all the information there, and then it will give you an answer based on the American Cancer Society information there. And then just to mention organizations that are trustable, obviously the American Cancer Society is trustable, but just to give you a little bit more information in regards to organization. The National Comprehensive Cancer Network is a very good organization, and their guidelines is what we use in general in medical oncology to guide treatment decisions, right? So in general, then if you're crafting a prompt in regards to cancer information, and if you ask the AI chatbot to give you information from the National Comprehensive Cancer Network, that would be the closest information to what your medical oncologist will give you, right? Because we get a lot of our information from their algorithms. So then that's a good one. The other one that is really good would be the American Society for Clinical Oncology. That's the other source of information from which we get a lot of our algorithms as well. So then that's another good one. So those two, I would say that then if you have very technical, very specific informations, I would first ask the AI to give you information from the National Comprehensive Cancer Network, and then from the American Society of Clinical Oncology, or both. Now, the other important thing is to limit the time frame. Then you can just say based on research published in the last 3 years, for example, so that the chatbot doesn't look in the entire available information in history for your answer. So you can just limit the information for the last 3 years, for example. Or if you're looking for particular information, let's say for clinical trials, then you will have to specify the location as well. That would be very important for the chatbot to know if you're located in Pittsburgh and you're looking for clinical trials that are only available in Pittsburgh. Okay, so once you ask your question, then the other important concept is that not to be afraid to then refine your questions. Most likely, the first time that you ask a question is not gonna the chatbot is not gonna come back with a useful answer. Sometimes it's gonna be way too general, and you're gonna have to be refining your question. So just go ahead and then ask your question again, or refine it. And if the chatbot response isn't what you need, then try rephrasing your prompt, add in more detail. Remember that it's a conversation, not a one-time question. And finally, just imagine that also you can have a panel of chatbots, right? So here I have a picture of like this panelist. So imagine like the woman, for example, here would be Gemini, and the guy here would be ChatGPT. So you can ask the same question to two different chatbots, and then see which one comes with the most useful answer, right? And then you can see which one is more reliable. So that is very important. That is just engaging in a conversation with these AI chatbots then can be very useful. And sometimes then they can help you understand very complex concepts, right? Maybe you had a conversation with your physician and you don't fully understand very well then what the physician told you, and then you may want to ask several chatbots then to help you understand it better, and have a conversation with the chatbot until you then get the response that you're looking for. And in regards to conversation, you remember, I mean, they have all the time in the world, right? So then they can spend a lot of time helping you understand complex concepts. And that, I think that's one of the strengths of AI chatbots, that they can really dig in and help you understand these very complex concepts. Now, critical evaluation is key, and now we're gonna go over the risks and the cautions that you need to be aware of. One of the main ones is that all chatbots are pleasers, right? So they actually they have been trained to be pleasers. They really want you to be pleased with the answer, and they will do whatever they can to for you to be pleased with the answer. Even if that means to give you misinformation, then they will give you misinformation if that pleases you, right? So you just be aware of that, right? Because I see people get in trouble because then they go with a preconceived notion of what they want to hear, and they're pleased to hear a particular answer, right? And then they just engage in a conversation with the chatbot, and then they go into a whole communication based on misinformation. So just be aware that that the chatbot is going to try to please you, and that's very important. You need to be cautious about it. The other one is that all chatbots can hallucinate, right? They will come up with answers sometimes that are totally not existing, that they just made up completely, right? So you can even be asking if, like about a doctor that doesn't exist. You can ask them that what is the opinion of Dr. George Clooney, for example, or an actor, and the chatbot make up that Dr. George Clooney is really a doctor or something like that, something that will be completely out of this reality and made it up, and then it's just that could be very dangerous, right? Then they could just straight tell you something completely false, and it will sound serious, and that's one of the main dangers about these chatbots. However, they're getting better at not hallucinating, but they still do it though. So just be very careful with that as well. And finally, in regards to the risks, then I have that all chatbots can lead you into misinformation rabbit holes, right? So once again, since they're pleasers and they hallucinate, then they can, and if you have a preconceived notion of what you're looking for, or a particular fear, right? Then they will just take you there, and then you may be concerned about. That something maybe a clot. Let's say that you're having pain in your finger, and then you're wondering if that may be a clot in your finger, and then the chatbot may take that information and may start then just convincing you that you truly can like have a clot in there. And if you're concerned that if you can die out of a pain in your middle finger, or in your small finger or whatever, then the chatbot may take that information and then just you know engage you in a conversation that you're gonna die out of that pain, even though maybe something totally trivial, right? So just be very careful that sometimes then chatbots can really just take you in a rabbit hole of misinformation. So it is just important to apply safeguards to the information that they're giving you. Check the chatbot citations or links to its sources, right? So if you ask the chatbot to give you citations, then it should be able to produce them. And that's why I like Gemini in particular, because Gemini then will give you the links, and then you will see them up front if you actually use the Google search, the regular Google search, and you ask then your question there, then many times then Gemini will answer at the very top of the search, and then it will show you the actual sources, right? So you can just check right there. So then that's the advantage of Gemini. You can also ask ChatGPT to give you the links, but once again, I mean, Gemini then just has them right there. The other thing is just compare chatbot responses with trusted sources, right? Then you can go to NCCN guidelines or to the American Society for Clinical Oncology, and then you see if the responses match. But in the end, then really for almost everything, you're gonna have to check with your healthcare team, right, to see if that information is reliable, right? That's ultimately going to be the only truly trustable source of information. But once again, I mean, sometimes then I think these chatbots would be the most useful when you're looking for to clarify information that you already discussed with your physician or your healthcare team, and then you're just looking for clarification or asking the chatbot to help you better understand the information that your healthcare team already gave you. So that's I think where the AI chatbots can really shine. Finally, then, just to mention something in regards to privacy, AI chatbots collect data to improve their performance, And so be aware of what the information you're sharing, because once you share the data with the chatbots, then that data is no longer private. They will have it in their database, right, for training. So, right, if you put your name and your address and what particular diagnosis you have, then it may be there. If somebody asks that is not related to you and somebody asks about you, then the chatbot may have that information and share it in the future. So it's just important not to be sharing information like that with the chatbot. So you just be very mindful in regards to privacy issues as well. So finally, then just to recap, then the pillars of safe and effective use of AI chatbots is, remember, digital literacy, all the items that we review with Rihanna, then they become very important here. Making sure that you perform your own critical thinking, and just take this as a partnership with a healthcare professional, right? So not just kind of like relying on an AI chatbot to help you answer all of your questions. I think once again, they shine more when you have already discussed certain topics, or you have already discussed the question with your healthcare professional, and you're engaging the AI chatbot to help you understand that information better. I think that's where their most of their power comes from. Or when you're looking, for example, for clinical trials in a particular area, then that's another thing that can help you with as well. Once again, use AI as a tool to supplement and not to replace the expertise of your healthcare providers. So with that, then I would like to thank you for attending this webinar, and we can open it up to questions. Thank you.
Thank you so much, Dr. Lopez Chavez and Rihanna, for that informative those informative presentations. Currently, I don't see any questions in the chat. If anyone has any questions, you can go ahead and pop them into. Oh, there's a question. What about reviews about individual doctors? So I guess the question is ChatGPT or the digital platforms valuable for reviews about individual doctors is the question.
The AI chatbots then will just rely in the information that is already in the web, right? So then I guess the question would be, what's already in the web, right? So then it just depends on what healthcare system we're talking about and what particular reviews are available and how they collect those reviews, right? So sometimes, for example, Google, in regards to the reviews, I think everybody can just make a review regardless of whether or not they're a patient, right? So then those Google reviews may really not be that accurate, as opposed to a Press Ganey, for example, that it's something that that they're that the way that they collect the information is more accurate and more reliable, right? So it depends. I don't know, Rihanna, do you have any particular information that you would like to share?
And there's some follow-up clarification, not necessarily chatbots, but if Google reviews and etc. So you started to go down that pathway as well. I'm not sure if you guys are as well able to see the chat.
Sure.
Additional question.
I could chime in here as well. Back to a previous point about, understanding others' personal testimony about their experiences. While that can be a great resource to bounce off of, none of that should ever be taken as fact per se. So, right, ultimately, reviews are just people's individual opinions and experiences, and obviously that can be taken into account when you are looking for a provider. Because those, results ultimately do mean something at the end of the day. Just remembering that, again, that particular person could have had, a slightly less than ideal experience with a specific provider, while the person that goes in to see them right after you has the best, experience with that individual. So just understanding that, those can be helpful resources. But again, to Dr. Lopez Chavez's point as well, sometimes reviews on Google could potentially be made by, spam accounts, resources like Press Ganey, or the ones that we know that are filtered through our patients specifically, like the surveys that they receive, at the end of their appointments, for example. Those can potentially be, a little bit more accurate. But again, it's ultimately in the eyes of the patient to do their research and kind of use that information as a tool in terms of informing their care decisions.
Great, thank you. All right, I don't see any additional questions in the chat at this time. So if there are no additional questions, we'd like to thank you all for attending our Ahead of Cancer lecture this evening. As a reminder, tonight's lecture was recorded, and if you're interested in rewatching tonight's lecture or any of the previous Ahead of Cancer lecture series, you can find them at the AHN YouTube channel, and this will be posted within the next several weeks. Here's the link to our YouTube channel as displayed here on the slide. Again, if you have any need to schedule an appointment or any questions regarding a potential cancer concern, you can call 412-578-HOPE, our HOPE line. And you'll be receiving an email follow-up questionnaire about tonight's survey, and that will include the link to our Ahead of Cancer lecture series as well in your email. So let me just check the chat one more time. Okay, I don't see anything else in the chat. So then I want to thank you all for attending this evening, and we will go ahead and close out the program. Thanks for attending. Have a great evening.
Thank you.
Thanks all.